Abdominal pain, I get many parents coming up to me saying, what is going on with my child's abdomen? He seems to be in pain. There seems to be problems. As a general pediatrician, I get a lot of patients coming in with abdominal pain problems, and I tend to do this with them. I give them my sort of my Victory V, which is you get the mechanical stuff, which is quite prevalent in charge, motility being one of them. The mechanical things aren't working, so that could be that there's reflux, motility issues. There could be things like we don't see so much in charge as inflammatory bowel disease problems, celiac disease can occur with anybody. Constipation, your gut's not moving properly. So those are the what I call the anatomical or the medical or the problems that you can sort of pinpoint down. Migraine as well, charge migraine, but that feeds into this one in a minute as well. And this one is more the behavioral side of things. So it's your gut, brain, it's how your gut is talking to your brain and your brain is talking to your gut. So when I presented on cranial nerves, you've got pathways going up and down that are speaking to each other. You've got the sensory, which is coming from the gut, going up to the brain. Brain is processing it, and then down it comes with some sort of message. Oh, you know, and then that message, thinking about it the other way, can be I'm anxious, I'm worried, I've got migraine symptoms, and I'm going to feed down and tell my gut I've got that, and it's going to complain for me. So the brain is actually doing its complaining through the gut. It can complain both ways. One can complain to the other. You know, they really are talking to each other. And when I explain that to the kids that I see, this is in my general practice, they get it. They really get it. So I'm not telling them they haven't got the pain, or it's just psychological, or it's, you know, it's them. I'm really picturing it as a real phenomenon. And of course, that happens in charge. And if you've got cranial nerves that are playing up, that are not doing their job, or they're being taken over by other cranial nerves, then you're going to get a real... No wonder there's abdominal pain. No wonder there's bloating. The bloating is very interesting. The bloating is probably to do with carbohydrates fermenting in a gut that's not doing this, that should be doing this, and moving along like that. It's doing sluggishly this, it's sluggishly that. And if you've got carbohydrate in there that's fermenting with all the bacteria, you're bloating. Think about it just in a bottle. So it's happening, and that's the bottle is the gut. So moving on to try and look at what's going on there, we can think of it as a problem. I think the best thing to think about is the problem motility. So if you haven't got the motility, is there anything you can speed it along? Sometimes small regular meals, less carbohydrate meals. We call it the FODMAPs diet. Horrible diet. Nobody wants to be on that sort of diet, but it's decrease in fermented products. Probiotics have been given a good press to work in certain situations. Massage. David Brown likes massage, and I learned that from him. I don't think he likes it personally, but I think the massaging of our kiddies with charge, or even our older people charge, to help that bowel move around, can be helpful, and to prevent constipation at the lower end, which we'll come to. So modifying the diet, I think, could be very helpful. There's something called late dumping syndrome that occurs about 1 to 3 hours after a meal. You get perspirations, palpitations, you can get hunger pains, weakness, tremor, syncope. All of those things can happen. Again, it's not common. We wrote a little case study of somebody that had that. They proved it. They worked with their endocrinologist to prove that. It all makes sense, actually, when you think about it. And it's very funny. When she sits down, she likes to relax with her tummy. We probably should all do it with her tummy poking out. She says holding it in, when I try and get her to hold her stomach, her tummy muscles in, causes a lot of discomfort, and she feels quite woozy with it. So sitting with your tummies out, like the Buddhas with their tummies out, and sort of breathing sort of naturally, or deep breathing, or or breathing like you do in meditation probably can help a lot. And it's probably helping from brain to abdomen.